Did you know one of your daily vitamins could cause a stroke? While you're asleep, many seniors trust these pills to protect their health, but new research reveals that 3 common supplements may silently raise your stroke risk overnight. Too much of certain harmless supplements can damage blood vessels, cause clots, and even lead to brain bleeds overnight. Stroke risk after 60 skyrockets when we overlook how these vitamins affect our aging bodies. Hi, I'm from Golden Aging Health, and today I'm revealing what you need to stop taking immediately before it's too late. We'll talk about stroke vitamins, how they harm brain health for seniors, and the science behind stroke causes in elderly adults. You'll also get stroke prevention tips from top experts, learn the early stroke warning signs, and hear real-life examples from people just like us. Please hit that like button and subscribe if you care about safe aging, and stay with me until the end because I'll also share a surprising vitamin that actually protects the brain. Let's get started with the first hidden danger.
Number 1. Vitamin E. It's often seen as safe, even essential, but vitamin E, when taken in large doses, can become a silent threat to your brain. It's linked to a higher risk of hemorrhagic stroke, something many older adults are never warned about. Yes, vitamin E, the one often praised for its antioxidant powers and heart health benefits, can actually increase your risk of hemorrhagic stroke when taken in excess. That's the type of stroke caused by bleeding in the brain. According to Harvard Health Publishing, high doses of vitamin E supplements, specifically over 400 IU per day, may raise the risk of brain bleeds by up to 22%. That's especially concerning for older adults already at risk due to high blood pressure or weak blood vessels. This fat-soluble vitamin has a natural blood-thinning effect. While that might sound like a good thing for circulation, it can quickly become dangerous, especially if you're also on medications like aspirin, warfarin, or even some herbal blood thinners. A retired math teacher from Arizona, Carol, started taking 800 IU of vitamin E every day after reading about its anti-aging benefits. But within months, she suffered a stroke in her sleep. Her neurologist traced it back to excessive vitamin E interacting with her blood pressure medication. She recovered, but she now warns other seniors not to self-prescribe brain boosters. Based on guidance from the American Heart Association, seniors over 60 should avoid high-dose vitamin E unless specifically prescribed by a doctor. It's much safer to get this vitamin naturally from food sources, where it's present in balanced amounts. Here's what you can do today. Check your supplement labels. Look for vitamin E, D-alpha tocopherol, or mixed tocopherols. Avoid products with more than 400 IU per day unless your doctor specifically recommends it. If you're taking blood thinners like aspirin, warfarin, or clopidogrel, speak with your physician before continuing vitamin E. Focus on food-based sources. Almonds, sunflower seeds, spinach, and avocado offer safe, balanced levels. Ask your doctor if you truly need extra vitamin E. Most people get enough through their diet without realizing it. Do you currently take vitamin E or a multivitamin that includes it? Have you ever experienced side effects from supplements? Let me know in the comments. I'd love to hear your experience. Vitamin E in high doses thins the blood too much, increasing the risk of brain bleeds, especially when combined with blood pressure or clotting medications. It's one of the hidden stroke causes in elderly adults that most people never suspect. Next, we'll uncover the bone-strengthening vitamin that might be quietly hardening your arteries instead.
Number 2.
is vitamin D. You've probably been told that taking vitamin D daily is a must for strong bones, right? But what if I told you that too much of this so-called safe vitamin could be silently hurting your heart and brain? It's known as the sunshine vitamin, essential for bone strength and immunity. But here's the catch. Excess vitamin D can lead to artery damage and raise stroke risk, especially in older adults. Seniors often start high-dose supplementation without regular blood testing, thinking it's harmless. But according to the National Institutes of Health, the recommended upper limit for older adults is 4,000 IU daily.
Surpassing that threshold may cause hypercalcemia, a condition where calcium floods the bloodstream. When calcium levels get too high, it can settle into soft tissues like arteries, leading to stiffness.
Over time, this can cause arterial calcification, making you more prone to blood clots, high blood pressure, or stroke. A 2021 study in the Journal of the American Geriatric Society found that seniors taking megadose vitamin D above 4,000 IU daily were 2.5 times more likely to show signs of arterial hardening compared to those with moderate intake. A large-scale observational study published in Arteriosclerosis, Thrombosis and Vascular Biology, a journal of the American Heart Association, followed over 20,000 adults aged 50 and older. The researchers found that individuals with very high blood levels of vitamin D, specifically above 100 nanograms per milliliter, had a significantly greater likelihood of developing arterial calcification. This means their arteries were literally hardening due to calcium deposits, a major red flag for both heart attack and stroke. The lead author, Dr. Aaron Michos from Johns Hopkins University School of Medicine, explained, "More isn't always better. Once vitamin D levels go too high, the risk of vascular damage starts to rise." This is especially concerning for older adults, whose arteries are already more prone to stiffness due to aging and common conditions like hypertension. The key message? Even a vitamin marketed for longevity can become harmful when used without proper monitoring. What should you do instead? Ask your doctor to test your vitamin D level at least once a year. Opt for natural sources: fatty fish, fortified cereals, egg yolks. Limit supplements to 2,000 IU per day unless prescribed otherwise. Get 10 to 20 minutes of sunlight a few times a week when possible. Vitamin D is essential, but too much of it, especially without blood monitoring, can harden arteries and increase stroke risk, undermining the very health it's meant to protect. Finally, we're going to look at a so-called brain booster that may actually spike your blood pressure right as you sleep.
Number 3. Vitamin B6. Not every supplement that claims to protect your memory is as safe as you think. One of the most misleading examples, vitamin B6, a common ingredient in brain boosters and energy blends aimed at seniors. It's often advertised as a way to sharpen focus, boost mood, and slow age-related decline. But here's what many people don't realize. When taken in high doses over time, B6 can damage your nerves, disrupt blood pressure regulation, and even increase your risk of stroke, especially while you sleep. According to the National Institutes of Health, the safe upper limit of vitamin B6 for adults over 60 is 100 milligrams per day. However, many over-the-counter supplements, especially extended-release formulas, contain 200 to 500 milligrams per dose. That's 2 to 5 times the safe limit.
Excessive B6 affects how your brain communicates with your cardiovascular system. It can cause sensory nerve irritation, interfere with blood vessel constriction, and contribute to nocturnal hypertension, a condition linked to higher risk of small vessel stroke in older adults. One of our longtime subscribers, let's call her Linda from Ohio, age 70, shared her story in a recent email. She had been taking a brain clarity supplement with 250 milligrams of vitamin B6 daily for almost a year. At first, she felt more alert, but then came the side effects: tingling in her hands and feet, poor sleep, and sharp spikes in blood pressure during the night. When she brought it up to her doctor, they ran blood work and found that her B6 levels were elevated far beyond normal. She immediately stopped the supplement and switched to food-based nutrients. Within weeks, her symptoms started to ease. Experts from Harvard Medical School recommend keeping B6 intake well under 100 milligrams per day unless prescribed, and getting most of it from sources like fish, turkey, bananas, and spinach. Here's what you can do today. Read your supplement labels for vitamin B6 or pyridoxine hydrochloride. Avoid daily doses above 100 milligrams, especially from time-release blends. Watch for symptoms like numbness, insomnia, or nighttime headaches. Discuss with your doctor if you're combining energy, sleep, or mood boosters. Know someone over 60 taking supplements? Share this with them. One small tip could protect their brain and heart health. While B6 is essential in small amounts, long-term high doses can disrupt the nervous system, elevate blood pressure at night, and increase stroke risk after 60, especially when combined with other supplements.
Here's a quick review of the 3 common vitamins that seniors should be especially cautious with, and may even want to stop taking if they're in your cabinet right now. What to throw out or avoid, unless your doctor says otherwise. Vitamin E. More than 400 IU daily may thin your blood too much, increasing the risk of brain bleeds and hemorrhagic stroke. Vitamin D in excess, more than 4,000 IU daily, can lead to arterial calcification, raising your risk of stroke, especially with high calcium intake. Vitamin B6, over 100 milligrams daily, especially in time-release or brain booster products, can damage nerves and increase nighttime blood pressure spikes. These vitamins aren't inherently bad, but the problem comes when we take more than we need, especially without regular blood tests or medical guidance. It's easy to assume that more is better, but when it comes to supplements and stroke prevention, balance is everything. The good news is there are vitamins and nutrients that actually help protect your brain and reduce stroke risk, especially for seniors. And here's the one I promised earlier. According to Harvard Health and the National Institute on Aging, one vitamin consistently linked to better brain aging is vitamin B12. Seniors are more prone to B12 deficiency, and low levels have been associated with memory loss, confusion, and even brain shrinkage. B12 supports nerve function, red blood cell production, and helps prevent homocysteine buildup, a factor linked to increased stroke and heart attack risk. If you're over 60, ask your doctor about testing your B12 levels, especially if you follow a plant-based diet or have digestive issues. Here's what you can do right now. Review your supplement routine, cut anything that exceeds safe levels. Schedule a checkup to test your vitamin D, B6, and B12 levels. Talk to your doctor before starting or stopping any long-term supplement. Choose food sources first and treat pills as support, not replacements.
Did you discover anything in your own supplement routine that surprised you after watching this video? Leave a comment and let me know. I always love hearing your personal health wins and lessons. If this video helped you stay informed and stay safe, please hit that like button, subscribe, and share it with a friend or family member who also takes supplements. Your support helps us grow and keeps this community going strong.